A woman in Texas has died after using a nasal irrigation device filled with tap water that led to a brain-eating infection. Here to discuss is internal medicine physician Dr. Nesochi Okeke-Igbokwe. Doctor, welcome to the show. And what a beautiful name.
Good morning. Thank you so much for having me on.
Of
Thank you.
course. Now, doctor, this is something most of us could not even imagine. What are the hidden dangers of using tap water for devices like just cleaning out your sinuses?
Yeah, so using tap water for cleaning out your sinuses by means of a nasal irrigation device, it's generally not recommended. There's always this potential risk of infection with various microorganisms. Now, in the case of this Texas woman who died of infection, what we call quote unquote brain-eating amoeba, she had what we call a Naegleria fowleri brain infection. Now, this infection is quite rare, but it is lethal. But the key is for anyone who does use a nasal irrigation device, you need to ensure that the water source is quite safe. Now, there are a few options in order to obtain safe water sources. One thing you can do is go to the store and obtain water that is distilled or sterilized, and it'll say it clearly on the label, distilled or sterilized. Now, if you are going to use tap water, one thing you must make sure of is that the water has been boiled for at least 3 to 5 minutes and then cooled before you actually use it in order to safely move forward with a nasal irrigation device.
Very good advice. So distilled or sterile water or boiled tap water. Thank you for that. I want to turn to a new discovery. Researchers finding that structured exercise improves survival for patients with colon cancer. This seems like incredible news. Tell me more about the study.
Yeah, it was a very promising study. It was a great study. It was a randomized controlled trial of around 900 patients that had colon cancer. These patients had standard surgery and chemotherapy as their treatment for colon cancer. Now, researchers assigned half of these patients into either a control group or a treatment group. The control group was what they called the health education group, meaning they provided these patients with educational materials that promoted healthy exercise and healthy eating. Now, the treatment group, that was the exercise group. Now, these patients, they actually had a personal trainer and a life coach who supported them throughout the course of their journey to help them improve aerobic activity by means of kayaking, running. Most of these patients just engaged in walking 45 minutes 4 times a week. Now, what the studies showed were that the patients that were in the exercise group, they actually had a 37% lower chance of dying from the colon cancer, additionally had a 28% lower chance of recurrence or development of a new cancer. So that's why it's so promising, because the study is really showing that a structured exercise regimen can improve potentially cancer outcomes.
Yeah, this
Why
is,
yeah.
not to interrupt, excuse me, that is incredible news. As a physician, doc, you have more experience with cancer than most. What is it about structured and consistent exercise that is so beneficial to a patient?
Yeah, so structured exercise, we know exercise in general provides health benefits in regards to cardiovascular processes, and now we're seeing in regards to cancer outcomes. The key, though, really is adherence to this, having a support system, having a structure to the exercise plan. Patients often ask, what do I do next after I've had my treatment for cancer? Now, the conversation and the discussion needs to integrate having this structured and support system available to ensure that they can gain some of the benefit from exercising routinely.
Let's talk about dieting and mental health, doc. It's already enough of a challenge to make a lifestyle change, lose weight. But there are researchers who are saying excessive calorie restriction could be linked to depression. I would love to hear your thoughts here.
Yeah, so anytime one is engaging in calorie restriction, you need to ensure a few things: that you are not extremely cutting off too many calories. Now, when there is an excessive restriction, this translates into insufficient nutrients in your system, nutrients that the body actually needs to complete its functioning. So this can translate into a low energy state, fatigue, sleep disturbances, and of course, mood disturbances. So this extreme caloric deprivation can actually negatively impact one's mental health state and increase the susceptibility to depressive symptoms. So here's the key. If you do want to initiate any change in your diet, it's always important to touch base with your doctor, with your physician, to ensure that you are not depriving yourself too much of essential nutrients and essential calories that the body needs. A supervised weight loss plan is always important, and it's the key to move forward safely on your journey to weight loss.
Now, the next topic is a bit controversial because I know people who swear by this, but after a long exercise, apparently a cold plunge, it's very refreshing. But there's a new study, and it reveals that it may not be as beneficial, as you think. Are the freezing temperatures worth it? Again, I know people who think it's the best thing they do. They claim to be so healthy after doing cold plunges almost every day.
Yeah. So when it comes to these cold plunges, there are purported benefits. Some individuals, athletes, they believe that a cold plunge will minimize the muscle soreness after physical activity. They believe that it helps with inflammation, and some people even believe that it improves their mood. However, this new study showed that individuals who engaged in cold plunging after they had a workout of just lifting weights, it showed that they had a decrease in blood flow to their muscles, and they essentially didn't gain so much benefit from the cold plunge. So they're saying in this new small study that there really is no benefit to cold plunging. Bottom line is the body of research that surrounds cold plunging is really insufficient to even deem any kind of ongoing benefit to cold plunging. So we really need more research studies. But the key is, because I know there are folks out there that are interested in cold plunging, again, you need to discuss this with your doctor. Why is that? Because there are some deleterious effects of cold plunging. Anyone who has a medical history of heart disease, hypertension, diabetes, issues with circulation, a cold plunge can actually be dangerous for those individuals. So speak to your physician first, and also be aware that there are other risk factors such as frostbite if you were to engage in cold plunging, and something called cold shock. There are some things that one can do in order to minimize the risk if you were to move forward with a cold plunge, to minimize the risk of the cold shock. So you would need to avoid getting into the water too quickly. Other things you should do, be cognizant of the water temperature. We typically say a cold plunge, make sure that the temperature is between 50 to 60 degrees Fahrenheit for the cold plunge, and other things to consider as well. The length or the depth at which you are in the water. Don't go in any more than the waist level. And don't stay in too long either. If you're a beginner and new to all of this, 30 seconds to 1 minute should be your starting point. But again, check in with your doctor before you even initiate any cold plunging.
Check in with your doctor. Always good advice. Dr. Nesochi, thank you so much for coming on this morning.
Thanks so much for having me.